Now we will begin today's webinar on exercise, a tool for managing cancer side effects. My name is Madison McMahon Ward, and it is my pleasure to introduce today's speaker, Sammy Mansfield. Sammy Mansfield is the founder of Cancer Wellness for Life. Sammy is one of the first cancer exercise specialists and wellness experts in the world. Her work straddles delivering wellness and exercise on the front lines of patient care to extended efforts with healthcare leaders, oncology organizations, and policymakers, including leading the Prevention Task Force for the Kansas Cancer Control Plan. Sammy is also the Director of Oncology Wellness for the Sarah Cannon Cancer Institute at HCA Midwest Health. Sammy is an experienced public speaker for both medical professionals and individuals, and she has developed countless educational materials on various topics such as fatigue and has consulted for clinical trials, cancer organization projects, and is a regular podcast guest. You can read more about Sammy on our website. So with that, I'd like to turn it over to Sammy.
Thanks, Madison, and our entire virtual audience for having me today. I am really excited to be here talking about exercise as a really key tool, because exercise really is a tool and a resource that is growing immensely for people affected by cancer, for caregivers, and really the research that's coming out is fantastic and something that I think is important for anyone impacted by cancer or wanting to prevent cancer to utilize. So thanks so much for having me today. Madison, if you could go ahead and move to the next slide, that would be fantastic. So today we're going to really talk about, thank you, we're going to talk a little bit about not only what does exercise mean in the cancer landscape, but we're going to also focus on how to develop a personalized exercise plan. But before we get started, I want to utilize just some base information for the entire audience today about what is exercise and why is it important. I think we can all agree that we should exercise. And there's this mindset of, I know I should, but really, why is it important? And then what should I do about it? So let's first talk in the cancer space about why is it important and how does it impact people affected by cancer. So I'd like to draw you to the image on the left. So this is an image that is an overview of the current recommendations for people impacted by cancer and how much and what types of exercise that they should do, as well as the benefits of side effects. So this is an initiative that you'll see from the American College of Sports Medicine if you want to look this up. The high-level overview is that the number one most important thing if you're impacted by cancer is to avoid inactivity. Moving more and sitting less benefits nearly everyone. If you're at home today, and just watching this webinar, I encourage you to even move while you're sitting there or stand up. Lift your arms, lift your legs. Avoiding inactivity is one of the most important things we can do for our physical and mental health. In addition to just avoiding inactivity, it's important to note that the general recommendations are that every individual achieves 150 minutes of moderate or 75 minutes of vigorous activity and exercise per week, including 2 days a week of resistance training. So what is moderate activity? That's exercise specifically, that you start to feel maybe a little short of breath. However, you can sustain for a period of time, maybe 1 to 5 minutes, depending on your current fitness level. Vigorous exercise is something that's going to get you out of breath faster and that you're going to sustain for a shorter period of time. So think about something that's going to make you feel a little breathy, like moving through your house or doing some light resistance training, versus something that's going to make your heart rate spike fast. You're not going to be able to have a conversation. That's considered to be vigorous exercise. It's also important to note that these exercise recommendations are including resistance exercise. And I'll talk a little bit more through the slides of the important value of resistance training exercise, because these were not included in exercise recommendations for people impacted by cancer until 2018. So it's fairly new to see this resistance training exercise as a key part. As you can also see, there's a lot of side effects that people are concerned with impacted by cancer: fatigue, physical function, health-related quality of life, things like depression, anxiety, sleep. These are all improved by having exercise as part of your daily regimen. In addition, below, there's some really specific things about choosing an exercise plan based on a symptom. I encourage you to take a look at that, but not target your exercise for that specifically, because symptoms will change day to day. And so we really want to draw back to the overall recommendations of having an exercise regimen, not only because they manage side effects and symptoms, but also prevent. In addition, this slide also talks about where the evidence is going. As Madison mentioned in my bio, I've been working in this field a really long time, actually since 2003. And when I started my career, maybe some of you'd be surprised. I was surprised there was not a single study that showed the benefits of exercise for people impacted by cancer in a controlled setting. And the first study really looking at quality of life and fatigue was not published until 2005. Now we're in this just space where we're seeing studies come down the road and be published nearly every week, really solid studies. And so, although I can't tell you everybody on the webinar today, there's a study that matches your exact cancer diagnosis or treatment plan, I would tell you that the evidence has shown that exercise is beneficial for every single person impacted by cancer, no matter what type of cancer, what stage of disease, and where you are in your time point. We've also started to see that adults who are meeting these recommendations that I mentioned on the left are actually having a reduction in all-cause mortality and cancer-specific mortality. That simply means death. And so we know that if you exercise, you are extending your life, no matter if you have cancer or another chronic health condition. This is phenomenal. And this is actually reiterating the importance of meeting these exercise recommendations that we're going to show you how to get to today. I think it's really important to also note that we are seeing evidence in really unique areas. Again, areas that you'll see here, such as metastatic colon cancer, improved survival with exercise, and looking at length of life and quality of life. For early stage breast cancer, fitness level is directly correlated with the ability to complete chemotherapy. So if you're sitting here today and you might have, either one of these diagnoses, you should exercise. You know that this is really going to be a powerful piece. In addition, prehabilitation with types of cancer such as cervical lung, we've also seen this in esophageal and other types, reduces length of time in the hospital. I know that most patients' number one goal of being in the hospital is to get out. And so I always encourage you, if you're preparing for surgery or you have something coming up, make sure that you're really engaging in those like inpatient rehab therapies, or you're exercising as you prepare. If we could go to the next slide, that would be great. Okay. Oh, I see I have controls. Thank you, Madison. So let's talk about what is exercise, because I think this is a really key question. So let's go back for a second and talk a little bit about physical activity first. So physical activity is anything that you do to move your body. So if you scratch your nose, you pick up your foot, you roll over in bed, you use the restroom, you pour a cup of coffee, anything that you do to move is physical activity. Exercise is physical activity that has a plan, a purpose, a goal, or an intention. So think about why we exercise. Are you exercising because you want to get stronger? You want to be fitter? You want to be able to play with your kids, your grandkids? You want to be able to go to the grocery store, tie your shoes? Anything that is focused on having an outcome is considered to be planned, purposeful exercise. So there's three main categories of exercise that we kind of look at when we're creating an exercise regimen. The number one type of exercise that I think most people impacted by cancer, including patients or caregivers, as well as our medical professionals, think about is aerobic or cardiovascular. So early evidence in exercise looked at walking as an exercise component, which again, is a really typically easy type of exercise, most of us, we know how to do it. We generally have access in our home or outdoors or at a gym setting. It is the type of exercise that increases your heart rate, and it's considered to be steady duration. So think about if you're moving around your home, you're maybe doing, tasks or chores, and you're feeling like your body is exerting itself, but you can go for a period of time of 1 to 3 or more minutes. That is considered to be aerobic exercise. Specific types of aerobic exercise, again, walking, biking, swimming, those types of movements are under that aerobic category that work your heart and your lungs. The second type of exercise category is resistance or strength training. This, for all of the listeners in the webinar today, honestly, in my recommendation as an exercise professional, is the one that we should target the most, because this type of modality of exercise builds up your muscular strength and your endurance, and is actually the type of muscle that you need to get out of your chair. That is specifically correlated to using things like the toilet or getting out of your bed, because you need those muscles in your thigh. So resistance or strength training is, in my opinion, one of the most underutilized types of exercise, because we've seen such a tremendous benefit in people's function. So what is resistance training exercise? Well, a squat or a push-up, or using weights or bands, kettlebells, or other type of modality, but also think about using your body weight. So if you're on that webinar today and you have this ability, stand up from your chair, sit back down, stand back up, sit back down, complete this 5 to 10 times. Notice that you're starting to feel some fatigue or burning sensation, probably in the top of your thighs. You are creating muscle fatigue. You're stimulating those muscles to actually work, and that muscle fatigue feeling that you are experiencing will send that signal to your brain to build those muscles up. And you'll actually notice that if you did that every single day, not only are you doing resistance training, you'll get stronger overall. So it's a simple thing that you can do at home. You don't necessarily need to have a lot of equipment, but anything that you do for overload of those muscles is actually resistance or strength. The third category that I think is really essential and is something that can be incorporated into the first two is utilizing your core. So here's a great way to utilize your core while you're on the webinar today. Pull your shoulders back, sit up really straight, lift up your chest, kind of lift your chin up slightly. Just by sitting up straight, you're now engaging your core muscles. Go back to that chair sit to stand and stand up. As you stand up, pull your shoulders back, squeeze your butt or glute muscles, and notice that your abdominal muscles get tighter. Again, you're using your core. Your core is really essential because it supports your low body and your lower back. It's really beneficial because it is a big reducer of pain and low back symptoms. But when you're tired, we tend to slouch. When we're on the computer, we tend to slouch. So just sitting up straight is a really great way to utilize your core. There's also other exercises here that you can do to target those muscles, but simply focusing on posture is a really great way to use your core. So you may not feel like exercising, and I think that's really important to note, especially in the cancer space. A lot of times there's a lot of side effects related to treatments, or somebody might be just managing the overwhelming other components of having a diagnosis, managing work and life and children and family and everything that we're trying to do every day. And I think it's important to note that if you haven't been exercising, or you haven't exercised for a period of time, you may not feel like it. And that's not always just motivation. There are physiological changes that happen that also change your body's physical ability to exercise, as well as your interest. So within 5 to 7 days, if you're not exercising regularly, your body will have less blood flow. You'll start to notice that your body isn't storing energy in your muscles. You'll actually start to lose a little bit of lean muscle mass, specifically in the bigger muscles. You'll have a little bit of fluid buildup in your lower extremities. You might notice that your feet are feeling a little bit more swollen. A lot of times people notice also in their gut and GI that you might be just a little bit more constipated because your gut is actually made up of muscle. And so when you're not utilizing your body's function continues to kind of slow down. And you may just not be as hungry because your metabolism is slowing down and mentally you're just a little bit slower. This again happens with just in a matter of days. And certainly, if you are maybe a pre exerciser and you haven't been exercised, don't expect realistically that you're going to feel motivated in a day, but just getting up and moving a little bit will kind of turn these side effects on the go side. And I think it's important to notice that even if they happen in a short period of time, on the flip side, you can improve them in a short period of time. So I think that's very important to note. It's also important to note that in just 10 days of bed rest, think about if you're recovering from a surgery or you've been feeling really ill for some reason, that your body will have a noticeable loss of lean muscle. So it's very, you just need to be aware and be okay that you're not going to be as strong as you were before. But if you work back up at small steps, that your body will recover. It typically takes about half of the time to recover as it was to go through that decline. So if you have 10 days of bed rest, it'll take about 5 days for your body to kind of get back to that normal phase. But this happens fairly quickly because your body is going to be preparing for recovery. Your body is going to be healing if you're going through things like chemotherapy or after surgery. And so if you're not using those muscles, your body just is not going to put fuel there. And that's just a normal part of how our body protects its vital organs. It's important to note that if you have extended periods of bed rest, you will have a significant loss of lean muscle tissue. So if you haven't been exercising for 30 days, you've been very sedentary for various reasons, you will have lost about 10% of your lean muscle. And although you can get that back, and it's very reasonable to get that back, you will need to reduce the place that you start and just really start with maybe smaller movements in shorter periods of time as you build back your strength and endurance. But I think it's important to note that this does come back much quicker than people think. And I think it's important to note that no matter how old you are, what type of cancer you have, or where you are in your treatment, you can achieve the benefit of returning in strength and endurance. So please know that anybody can do it no matter where you are. All right, so I want to talk a little bit about some of the changes that happen. So if you look at the slide on the left, I put this diagnosis and treatment kind of bubble first. So for some of you, you may be newly diagnosed, you may be, several years out, you may be living with an advanced cancer, you'll be in treatment for the rest of your life. I want you to look at this particular time point, either in a retrospective where you were or maybe where you are today, and note that there's typically two directions that happen that cause physical and functional changes. So there's a lot of clinical changes that happen related to a lot of our treatments. A lot of times people will experience neuropathy, that loss of sensation in the fingers and toes from chemotherapy. This can affect your balance as well as other tasks such as writing, typing, utilizing buttons. These are things that actually are related to a clinical treatment or side effect. We can't always control them. We can reduce them or reduce the severity sometimes with things like exercise. And we are seeing emerging benefits of neuropathy related to chemo with exercise, but it isn't a cure and it isn't a fix. It just will reduce the severity. So a lot of times people are like, can I prevent neuropathy? The science hasn't been that we can, but we definitely know that for people that exercise, the neuropathy is less severe. You may have changes in your blood counts. These are related to chemotherapy. There is not an exercise strategy that will change that, but we do notice some benefit in severity and also some improvement in things like improved white blood count or red blood count from exercise. So I think it's important to know that within reason, there's not a fix, but potentially a strong improvement. So these clinical side effects may increase your fall risk and then change your quality of life. But although they will be part of your life changes, again, it's important to note that the sedentary behavior, the controllable piece, is what I really want you to focus on, no matter where you are in your diagnosis or survivorship. So sedentary behavior, I put functional fatigue. So think about when you're less active, when you're more sedentary, Doing functional activities, climbing upstairs, maybe being in your kitchen for an extended period of time, making a meal or doing errands such as grocery shopping, tend to feel a little bit more difficult. Goes back to that earlier slide we had where if you're not utilizing those muscles for a period of time, those muscles kind of take a long hiatus. They sort of go on vacation. This is actually the controllable piece, no matter where you are, or even if you're a caregiver or a medical, maybe a social worker, this sedentary behavior and functional change is something that we should all be working on. So what are the side effects from just being more sedentary? Decreased shoulder range of motion. This is all of us. Again, think back to a previous slide. As you're continuing to listen, what's your posture? Are you sitting up straight? If you're not, pull those shoulders back. That improves your shoulder range of motion. Reach overhead. Can you pull your arms up beside your ears? If you can't, that's a simple thing that you can work on every single day to reduce your shoulder pain, improve your posture, improve your mobility, improve if you want to scratch between your shoulder blades. Doing these types of exercises keep the shoulder joint supple and mobile, and are really beneficial even if your cancer does not impact your upper body. Sedentary behavior also makes those changes in that loss of lean muscle mass. I think it's important to just remember that if you aren't exercising prior to a diagnosis, you may not have a tremendous amount of lean muscle mass due to just that natural aging process. I think it's important to note that even if you're 50, you're 80, wherever you are, if you have loss of lean muscle, being more sedentary is going to accelerate that and make things harder. So anything that you can do from that time point today is still going to make a really big difference in how you function. As people lose lean muscle, a lot of times very simple activities such as walking, especially up and down stairs, going up and down a curb, can be difficult. And a lot of times we notice that people's posture changes. They look down, they look forward, they have to use assistance to get out of a chair, etc. That muscle mass is going to change functional movement and also create uncertainty in how you move. And I think it's important to note that just by improving your lean muscle, all of your movement every single day is going to improve. We also notice a lot of difference in grip strength. So think about opening that jar, or if you wash your hair and you're having to use your hands for an extended period of time. We've seen a lot of clinical evidence that decreased grip strength, that hand grip strength, which comes not only from the hand, but also the upper arm, creates a lot of difficulty with ADLs or activities of daily living. So utilizing your hands extendedly is going to be a little bit more difficult. We're also starting to see a lot of evidence showing that grip strength has another impact on mortality, especially in our older adults. So again, lifting up small weights, holding onto a resistance band, all make a really strong improvement in your grip strength overall. So important to note that there are clinical changes that happen with your physical function, and then there's lifestyle changes. We're going to focus on this bottom half of the slide and the things that you can control. So I want to talk next. What are the barriers to exercise? You can see here that I have a lot of little buckets, and I think everybody can kind of fall into one or more of these. I think the most important things that we really want to look at is the number one, top left, I don't know what to do. If you haven't been exercising or your exercise regimen may not fit into where you may be now after cancer, you may not know what to do. And I think that's really very relevant. You may not know where to start. Like, I don't feel like starting. I don't have equipment. I can't go to the gym. My doctor didn't tell me to exercise. I want to tell you that no matter what barrier you have here, I think it's really important that noting you're here, you're obviously interested in exercise, having a home-based plan even to start is simple and is probably much lower barrier than people think. So again, if you're not sure, okay, where to start, go back to what we mentioned a couple of slides ago, stand out of your chair 10 times and you're already exercising and we'll be seeing those benefits. I think it's important to note that there is also a mental, emotional, and neurochemical neurochemical response to exercise. I call this the dose responsive exercise because we all need a daily dose. There's a saying that if exercise could be in a pill, everybody would take it. And I think that might actually be fairly true, because it would be really simple, right? And so I think it's important to note that even when you don't feel like exercising, just moving and doing planned exercise for a minute changes the chemistry in your brain, which is tremendous, not only if you're impacted by cancer, but you just want to feel better day to day. So there's 4 neurochemicals in your brain, and there's a lot of more science behind these. So if you want to dig deeper, there's a lot of good resources you can look at. But in high level summary, I want to talk about these main 4. So dopamine is a reward chemical that comes when you accomplish something. So for those of you that are on here and you love a checklist, write down, I'm going to exercise for 5 minutes today and check that off. When you do that, you get your hit of dopamine because you're accomplishing something and you get that reward. That helps you feel a little bit more accomplished and a little bit happier. Oxytocin is a love hormone. It comes when we, hug somebody, you smile at somebody. It happens when somebody tells you, hey, I can really see a definite difference in your strength or your energy. Your posture looks better. You actually will receive a little bit of oxytocin. Another great way to get oxytocin is exercising with somebody or taking your dog for a walk. These are really great ways to kind of get that feel good hormone and that sort of response of just moving and feeling stronger together. Serotonin is a mood stabilizer. If anybody has been treated for depression or anxiety, a lot of times the medicines that you take have to do with the serotonin in your brain, and they change how your body processes those types of chemicals. Serotonin is actually produced by a lot of types of exercise, especially when you have the ability to exercise outdoors or in the sun. So if you're in a Midwest winter or an upper, East Coast winter, this may not be something you can do every single day, but if you can get a little sunlight every day, it will actually improve your serotonin. So definitely try to get outside and walk if the weather is appropriate. And lastly, the most well-known neurohormone that comes from exercise is endorphins. This is really important because endorphins are produced by exercise, especially vigorous exercise, and it is actually considered to be a painkiller. So people that exercise at a little bit more of intensity or do a little bit more interval training have higher levels of endorphins and lower reported pain. Now, you don't have to necessarily jump up and down to get endorphins, but if you can push yourself to feel a little bit more breathy when you exercise, we do see a change in your endorphin production and improved pain management. So something to think about if these are side effects that you're experiencing. So what to do? The most important part of our talk today. Number 1, build muscle first. Muscle is going to help you with every single thing that you do every single day. Bending down and putting your socks or shoes on when you have a significant loss of lean muscle, if you've experienced that significant amount of bed rest, you will notice that that becomes a hard task. So I want you to think about building up your muscle as your priority and letting your aerobic exercise be all of those activities that you do to manage the quality of your life, from things like laundry or meal prep, etc., and really focus on the resistance training as the foundation. Focusing on functional movements is when you do movements that help you in all of the other day-to-day functions. So think about if you're going to do an arm curl, like a bicep curl with a weight or a soup can. It targets just that upper front part of your arm. And that's a great muscle, but your biceps don't help you roll over in bed or don't help you with any other of the physical activities that you do other than lifting your coffee cup or your water glass to your mouth, which is great. But I want you to think about focusing on functional movements that help your entire body function. Back to just sit to stand on your chair or stairs. These are great exercises that will make a difference in your full body function. It's also important to think about starting based on your current ability or functional level. This is actually where this next slide is what I want you to consider. We call this the active method to find your starting place today. So we have 3 categories of where you start. Think back to those general recommendations that I mentioned in the beginning, the 150 minutes of moderate, 75 minutes of vigorous exercise per week, including your 2 days a week of resistance training. That's the general goal that I want everybody to think about, but we want to find the right starting place for you to accomplish that goal. So there's 3 categories. Number 1, if you haven't been exercising consistently or have limited experience, I want you to focus just on action first. Just get moving every single day, if possible, more than once per day, starting with 10 minutes daily of strengthening. So simple things that you can do in addition to, as I mentioned, sit to stand, countertop push-ups, pressing your arms overhead, lifting one leg at a time, one knee to your chest, reaching forward in your chair to touch your toes and leaning back to straight. These are all strengthening exercises for various muscles of your body. Again, 10 minutes at a time, small doses. So you manage your fatigue and your function where it's not going to wipe you out. It's going to help energize you. It's important to note that you don't have to accomplish, the 150 minutes in one session. Focusing on your posture and your balance, especially if you haven't been exercising, will be key. So make sure that every movement that you're doing, you're taking a moment to adjust your posture. You're taking a moment when you're standing and brushing your teeth to check your balance, or standing and focusing on your balance. These are all really great starting places. If you're in the middle category, you might have a history of exercise. You've kind of been moving regularly on most days, but haven't had a specific plan. I want to make sure that you're doing strength training. That's going to be, of course, your target if you're not doing it, and adding resistance. So what do I mean by adding resistance? I want you to start to add load, either with increasing the challenge of your body weight exercises. Maybe your countertop push-up now goes to your dining room table. You're making that a little bit more challenging. Maybe your chair sit to stand, you're going to hold something. You're going to hold a sack of flour or a 5-pound weight or whatever that may be. You're adding load to those muscles to make those muscles grow and improve your strength. Additionally, I want you to take that next level of your posture by adding specific core and mobility training. When we don't move, we lose a lot of flexibility in our muscles, also our joints. Our joints may be creaky, they may not move the same, they sort of lose that fluidity, and that happens as we age or as we don't use them. Think about if you've had a chain on your bike, that chain that turns that crank. Sometimes we need to lubricate that chain. Your muscles are the same. They need to have that movement to create lubrication, and that actually improves their ability to move overall. So if you've been kind of exercising, but you really want to have a structure, really focus on targeting that 15 or more minutes on most days. If you exercise 30 minutes, 5 days a week, you're going to target that 150 minutes per week, or it averages about to that 22 minutes per day. So think about that if you're kind of in that middle category. If you've been exercising, maybe you're like generally exercising in a regular capacity, you're like, I'm already meeting the 150 minutes per week, then I really want you to push yourself to strive for the vigorous exercise intensities, no matter if, your age, no matter where you are in treatment. Push yourself to increase that heart rate a little bit greater, because you will get a lot of different physiological responses. You're going to definitely see the difference in your strength and endurance. And we're starting to see benefits in vigorous exercise for also things like mental health and sleep. So striving for vigorous will improve your fitness levels just at a little bit greater capacity, and really target those functional fitness movements. Think about doing multi-joint exercises where you might be doing a sit to stand and adding a shoulder press. So you're now getting your knees, your hips, and your shoulders in one movement. So definitely pushing up at a little bit different intensity would be the best way that I would encourage you if you're in that train category. So okay, now what do? I want to give you guys a sample of a particular person that I have worked with and what I recommended to her for exercise. So you can see kind of what I call a case study or a true patient example. So I want everybody on here to meet Miss Karen. Karen's 69 years old. She had stage 2 breast cancer about a year ago. Karen's a retired school teacher, and she enjoys different activities such as volunteering in her schools, reading, knitting, and time with her grandchildren. I want you to note that in some of her activities, note that reading and knitting are likely sedentary behavior activities. And I think that's important to note because I'll come back to this in a second. Karen's had a bilateral mastectomy. She opted against reconstruction. She went through chemo, and she's currently on an aromatase inhibitor for about 10 years. She reports some fatigue, some achiness. She has a little bit of neuropathy with her fingers related to her chemo. She has expressed some frustration, especially because she loves to knit, but it's pretty manageable. She's got some moderate neck pain, just really general, but she doesn't have any issues with her shoulder range of motion. And she's really reported some difficulty sleeping, especially the last year. She likes to walk a few times a week with a friend of hers, about 2 miles. That takes them about 40 to 45 minutes. She does that really pretty regularly. Her biggest frustration is she's gained about 15 pounds since her diagnosis. And she just feels that her daily tasks are getting more difficult and she needs to rest more. When asked about an exercise plan, Karen was open to anything. So what do we recommend? Well, Karen, as you may recall, was 69 years old. So if you're in a Medicare population, you'll have access to Silver Sneakers. Silver Sneakers is an online program. It's also now post-COVID offering a lot of in-person programs at things like the Y. And she goes to 3 times a weekly classes. Karen loves social exercise. So for her, community was really essential. And a lot of Silver Sneakers is focused on functional exercise, utilizing resistance training. So in COVID world, we know that there was a lot of need for online classes. So she did a lot more in that COVID world online, but she's definitely been going back as she feels comfortable. But online for her has also been a great option. She also have increased her walking because she wasn't quite meeting the resistance or the total recommendations. I'm also trying to increase her to do or encourage her to do a new route. As I kind of mentioned to you guys, walking outdoors improves serotonin. Having a variety in exercise also improves serotonin. So that new route each week is going to improve mental health, improving her sleep, but also change the muscle stimulation she may be feeling. Your muscles will adapt if you walk the same route every single day. So taking a different direction on a trail or going a different direction on wherever you walk, inside or outside, upstairs, downstairs, make a really big difference. So think about that of making sure you're doing things at doing different types of things. In addition, I wanted her to get really comfortable with doing, more exercise on a regular basis as part of her routine. And I wanted to improve her upper body strength so her shoulder range of motion improved. So every day, Karen does 30 countertop push-ups and 30 chair sit to stands every single day. She makes this part of her morning routine. She does it at a scheduled time. And then she stands on each foot as long as possible after she eats breakfast. Her mentality was, I put my dishes away and then I stand on one leg as I'm standing in my kitchen because I want to improve my balance. And this is a great way for her to check her posture. So often she does her countertop push-ups there as well because she's already in her kitchen and she's found that that's the best place for her to do those types of exercise. So this is an appropriate program for a beginning exerciser. Remember our active slide from before, and also our middle exerciser. If you're in that T-train category, this is probably a bit too low of an intensity for that category. But for those first two, this would be a great place for you to start, no matter what your diagnosis, your age, etc. Look at these at least 2 to 3 bullet points as a foundation for your exercise. So this is a little summary of the active category and kind of how to work through this to get to where you need to be to implement your own exercise. So on the top, I want you to think about which category you fall into, A, C, or T. I think it's important to address that do you need to talk to your physician Do you need to ask for help, such as a prescription or a referral? As an example, you'll see down below that if you want to go to physical occupational therapy, you may need a referral. If you're not sure what exercise professionals may be in your area, talk to someone in your medical team. They may have a great resource for you as well. And certainly, I'm happy to provide those resources or some guidance on those. The American College of Sports Medicine's Moving Through Cancer initiative has a great database online. There's definitely great resources both in person and online that are available. But talk to your physician and maybe ask for guidance. Secondly, you need support. It's important to feel encouraged. Again, talking to your physician, making sure that there's not side effects or symptoms that they're concerned with, I think is number one. Most physicians, and the research has shown that nearly every oncologist encourages exercise, but I think it's important to have that conversation, both because you will feel encouraged and supported, but also to make sure that any side effects or symptoms may be addressed at that time, depending on where you are. Get the support of family or friends, get the motivation, or maybe find someone to exercise with. I think it's important to feel supported, especially when we may not be feeling motivated. And then on the right, make sure that you're addressing your barriers or fears. Is it, I don't know what to do, I'm concerned of falling, I don't have the extra financial means to exercise. What is it for you? I think important to write down and address, and then kind of look at those individually and know that most of those can be overcome, especially if you think about it a little bit creatively from what we've presented here today. So on the left, once you know that you're going to exercise, you gain your support, let's think about location. Are you going to exercise at home? Are you going to go to a community or gym setting? Or do we want to start in the rehabilitation setting with a physical or occupational therapist? So there's great resources everywhere. And I think that, you know, wherever you start is going to be perfect. Think about what makes the most sense for you. Lowest barrier, easiest for you to do on a regular basis. If you are wanting to do physical or occupational therapy, it is likely that you will need a physician referral. If you're not seeing your physician, maybe in the next month or two, often you can call your provider office and ask for that referral. And most physicians are really happy to send that because they do see the benefit. And then again, on the right, going back to your barriers and fears, if you're concerned about things like your energy, you're in treatment right now, I go back to thinking about those categories and just start even with a minute or 3 minutes at a time, managing your energy. But no matter where you are, you can exercise, and I really encourage you to do so. So lastly, these are my simple but not necessarily easy strategies. We talked a little bit about assessing your priorities. Think about that through the last slide. Set your goals. Always ask yourself, why do I want to exercise? What do I want to accomplish? For everybody, this is going to be a little individual. And I think it's important to note, why are we doing it on the days we don't feel like it? If there's a day that I just want to feel normal, or I want to get stronger, these goals are going to help get us through. Making time, and I put add or remove, thinking back to getting 150 minutes of moderate activity per week, and I mentioned is only 22 minutes per day. You've been listening to this webinar for over 22 minutes. So if you were exercising throughout the webinar, you would have already accomplished your goal amount of exercise for the day. So I think that it's important to note that it doesn't take a lot of time to actually exercise. So if you're busy, think about, all right, is there anything I might be able to take away from my schedule? Am I doing something that doesn't really serve me and I'm doing as a distraction? And maybe that's my new exercise time. My fourth bullet is start with strengths. This goes two ways. Start with strengths because, as you have heard multiple times during this webinar, I'm a huge proponent of resistance training, but also start with your strengths. So as an example, if you feel good doing a certain type of exercise or certain modality, I want you to do it. Even if it's walking or a recumbent bike or maybe that foot pedal bike, maybe that's not, the exercise regimen that Sammy recommended today, but guess what? It's better than not doing anything. So start with your strengths, build habit, and then go from there. Small, frequent steps. We need to be mindful that even 1 to 3 minutes of exercise at a time, like a little exercise snack, doing that multiple times a day is going to help us much greater than trying to accomplish 30 minutes when our body and our schedule doesn't allow for it. So think about moving and exercising in small doses. And then lastly, celebrate the fact that you are accomplishing that. Recognize that I've done more today than I did yesterday, or I had a setback and I'm still exercising. These simple strategies will help you feel successful. They will help you notice physical and physiological and mental changes and improve how you live your life every single day. So in wrap up, I want to do a special thanks to Triage Cancer for having me here today, talking about exercise. There's a tremendous amount of resources when you look for cancer exercise strategies. And I hope the most important thing that you do today is leave this webinar or finish this webinar feeling empowered of where to start. Thanks, everybody, and I hope you have a fabulous day.